USA Health has the only reconstructive urologist on the Gulf Coast. Dr. Jatinder Kumar joins us to tell us more about urethral stricture disease and treatment options. Dr. Kumar, thank you so much for being here.
And thanks for having me here.
All right, so let's start with the general. What is urethral stricture disease?
So urethra is the tube which carries urine from the bladder to outside of the body. If we look here, and this is around 25 centimeter long tube in males. Urethral stricture is progressive narrowing of this tube, which happens more in male as compared to female, just given the length of urethra.
Gotcha. And we're going to try to get a tighter shot of your model here so we can see what you're talking about here. How common is this? And you kind of mentioned some age groups there, but how common is this?
So it is found in around 0.5% of the population in males. So kind of like 500 out of 100,000 people.
All right.
And it happens more in older age, and after 55, it's significantly high as compared to young people.
All right, so how do you know this is starting to happen? What are the symptoms that you start to experience?
So people start having difficulty in urination. They will have a slow stream, thin stream. They may have to strain to urinate, and they may feel that they are not emptying their bladder well.
Gotcha.
Other than that, young people can have difficulty ejaculation, where they don't ejaculate in spurts, rather than it trickles out.
All right, so, well, we did have a shot of that for a second there. What are the possible causes of this? And let's get into the treatment options.
So the most common cause is still not known. So we call it idiopathic. In past, it used to be infection of urethra, known as urethritis.
We got a shot of your model here, doctor. Can you show us a little bit about what you're talking about?
Yes, so the urethra is the tube which brings urine out from the bladder, out of the body through the penis, and this is around 25 centimeters long. So when this gets narrow, the tube inside the penis is what is known as urethral stricture.
Gotcha. All right. So we talked about surgical procedures, treatment options. Let's discuss those more in length now so people know what can be done about this.
So treatment is mainly surgical. There is no medicinal option available for stricture disease. The common treatment done is dilatation of urethra or endoscopic treatment. The more important treatment is urethroplasty, where we actually reconstruct the urethra. And according to guidelines, we should dilate just once if dilatation does not work, which fails in almost 100% of the time.
Wow.
Then reconstructive urology comes into place, where we reconstruct this tube using skin from inside of the mouth and replace the urethra with new tissue. And that's the only long-term option with around 95% success rate, and that's the only option available.
We mentioned in the intro that you're the only reconstructive urologist on the Gulf Coast. How long has this surgical procedure you've been talking about, how long has this been in place? How many times has this been performed, so to speak? Tell me a little bit about that.
So reconstructive urology with urethroplasty is out for more than 40 years now. So, but sad part is not many urologists are trained in it.
Gotcha.
So it is not a new procedure. I'm not reinventing the wheel. It is just practicing what has already been tested in time and is known to work.
All right, so if someone out there has questions, they're watching this interview perhaps and thinks, you know what, that may be something that's happening to me right now. How can they get in contact with you, your office, set up an appointment, set up a consultation? Tell us about that.
Yeah, so they reach out to my office, and then they will schedule an appointment. If a urologist has a referral, then they can just reach out to me directly, and we coordinate everything then.
All right, perfect. And we have that contact information on the Studio 10 tab, so go check that out on fox10tv.com. Dr. Kumar, thank you so much.
Thank you again for having me.
Yeah, appreciate it. All right, Chelsea.